How to cure OCD? Actually, let's start with complete honesty. OCD can't be permanently cured. If someone tells you otherwise, it's not true. Because OCD is not an infection or a viral fever. It's a condition like diabetes. You can't cure diabetes, right? But with the right treatment and a proper diet, you can reverse it and manage it well. OCD is similar. It can be reversed and managed, but it's a condition that needs ongoing care. So the right question to ask is, how can you reverse OCD? To answer that, there are two things you need to understand. First, OCD is unique to everyone. Let me explain. OCD is caused by a combination of biological, psychological, and social factors. This is what we call the biopsychosocial model. For instance, biologically, you might have a genetic trait or an imbalance in brain chemicals like serotonin. Psychologically, your thoughts, emotions, and past experiences play a role. And socially, your environment, relationships, and stress levels can trigger or worsen OCD. Now, the combination of these three factors is unique to each person. That's why OCD looks different in everyone. Diagnosing and treating these root causes is the key to reversing OCD. Second, OCD is a spectrum. If you don't treat it, it gets worse. The reversal of OCD depends on the severity. If you treat it early, it's easier to manage and reverse. But even in severe cases, with the right approach, you can significantly manage the symptoms and improve your quality of life. Now, let's talk about how to treat OCD effectively. Number one, cognitive behavioral therapy. CBT is the gold standard for treating OCD. ERP is exposure and response prevention. And here's how ERP works. Exposure, that is, you will be made to face your fears. And response prevention, that is, therapist will guide you how not to engage in compulsive activities. For example, if you have a fear of germs and wash your hands repeatedly, ERP will guide you to gradually reduce hand washing and sit with the anxiety until it decreases. Over time, this breaks the cycle of OCD. Number two, cognitive restructuring. This is another part of cognitive behavioral therapy. It involves changing the way you think about your obsession. Let's say you have the thought, if I don't check the stove 10 times, the house will burn down. Now, cognitive restructuring will help you challenge these thoughts. It will help you realize that it's irrational and replace it with more balanced thought. Over time, this helps reduce the power of your obsessions. Number three, medication. To manage OCD symptoms, doctors often prescribe medication based on your condition. Depending on the severity of your symptoms, a combination of medications may be used to regulate the brain chemistry and reduce the intensity of obsessions and compulsions. Your healthcare provider will decide the best course of medication for you. Number four, mindfulness and relaxation techniques. See, when you practice mindfulness, you can create a space between yourself and your obsessions, which reduces anxiety. Meditation, a deep breathing, and progressive muscle relaxation can also calm down your nervous system and make it easier to deal with OCD. Number five, support groups. See, when you're going through OCD, you feel like you're the only one. And that's why support groups are so important. Being able to talk to others who are going through the same thing can be comforting and helpful. Whether you are in a group or you are in an online community, support is very, very important. Number six, lifestyle changes. Exercise, sleep, and eating right all play a major role in managing OCD. For example, when you work out, endorphins are released. And when you sleep properly, it will improve your mood. And when you eat a healthy diet, it helps you stay mentally healthy. And these lifestyle changes are important for keeping OCD in a check. Number seven, avoiding triggers. If there are certain situations or places that trigger your OCD, you can avoid them when you are in the early stages of treatment. But remember, it's a short-term solution. It will help you prioritize and work on your treatment. In a longer run, you should not avoid them forever. Slowly, you have to learn to cope with them. Number eight, family support. Getting support from your family for your OCD is critical. It's important for them to learn about OCD so that they can understand what you are going through. Your family can actually help you recover without enabling your compulsions by creating a compassionate home. Family therapy sessions will help a lot. Number 9, Long-term management. If you start feeling better, take your prescribed treatment regularly and practice coping mechanisms for OCD. OCD is a chronic condition. It's important to follow a consistent therapy routine, mindfulness practices, and lifestyle changes to manage it long term. To summarize, OCD requires a three-dimensional treatment approach: biological, psychological, and social. It's a chronic condition and needs holistic treatment. You need to understand its complexities and commit to a long-term approach. Remember, it's not just about stopping the compulsions. It's about addressing the underlying causes and maintaining control over your life. Thank you for watching, and remember, you are not alone in this journey.